Bonjour et bienvenue.
Good afternoon and welcome to today's Facebook Live session on COVID-19. My name is Bruce McFarland and I'm here with Dr. Jennifer Russell, the province's Chief Medical Officer of Health. And I thank you for joining us for this Government of New Brunswick Facebook Live event. And Dr. Russell is here with us to talk about COVID-19.
Joining us, my name's Bruce McFarland. I'm here with Dr. Jennifer Russell, the Chief Medical Officer of Health for New Brunswick, and we're here to talk about COVID. If you prefer to listen and watch in French, please switch to our French Facebook site, www.facebook.com.
If you want to we encourage you to give us your points of view and to ask us questions in the comments section. We will do our best to answer as many questions as we can.
To add your questions into the comment section, and we'll try our best to answer them. Just to let you know, this is the same room that Dr. Russell, the Premier, and other ministers use for the media conferences, and traditionally it's members of the media that get to ask questions, but we decided to open it up to you, to New Brunswick. C'est à vous autres à poser les questions.
You can ask questions now. How are you, Dr. Russell? Very well, thank you.
Asking you the following question. Pourrez-vous nous expliquer pourquoi?
Can you tell us why it takes sometimes up to 1 month before saying that any zone has no cases, as it was for our Zone 5, as there had been at least 25 days without any cases? Yes, well, certainly we have processes that are used to make decisions, and they're evidence-based, and their evidence is based on is the base for all decisions. For example, wearing a mask turned out to be a very effective way of limiting the spread, and since the COVID-19 is continuing to grow outside our borders, this is becoming one of the more wearing a mask has become a very effective way of limiting the risk. But that said, we have to balance that with the needs of the people, and that's why all decisions are reviewed by many committees. So why it took more than 25 days, it's that there have to be two incubation periods, which are 14 days each, and it's only then that we can tell whether an outbreak has ended.
For a zone to change alert levels.
So changing alert levels is based on a risk assessment that we use with a great team. Actually, that was we wanted to have an acronym that said GREAT, but I can't remember what all the letters stand for now. But this team is made up of our epidemiologists, our medical officers, members of the management team at Horizon and Vitalité. So when we do the assessment, we are looking at 3 categories of risks and triggers. And we're looking at the one column, one category is the hospital capacity, whether it's on a hospital bed capacity side or whether it's on a human resources side. Then the public health category includes tracing, testing, contact tracing, testing, whether or not the public is adhering to our recommendations and our guidance and direction. And then also there is the epidemiological side of things where we look at the number of cases. How quickly are the case numbers doubling? That's a very important measure. Is there community transmission whereby we can't trace the cases back to a source such as travel, because that's where we are looking. And so that category really is also about looking at where the transmission is happening. So is it happening in a vulnerable population setting like a nursing home, et cetera? So those are the types of things we take into account. And if you meet certain criteria in each one of those in the context of the bigger picture of what's happening around it, then that's when we look at going to orange or a red phase.
So I'm going to stop all the inbox questions now. Zone 2 is currently in orange.
Yes.
Can you talk about, I know last Sunday at the press conference you mentioned that risk assessments might come. Can you just give us where you think things stand now? Like, what do you see?
So when Zone 2 went into the orange phase, we were seeing a quickly rising case number. So the doubling time was very worrisome. We saw it in a vulnerable population setting in the Shanix. And then we were also seeing the impacts on the healthcare system, whereby healthcare workers had to self-isolate. There were many involved in the contact tracing in terms of having to self-isolate or having been infected themselves. And we also knew that some public health measures weren't completely being adhered to. And also, we also knew that we were falling behind a little bit in terms of our testing.
Okay.
So once we were able to address all those things, we definitely have seen a big improvement in terms of the number of cases. We're still seeing the Shanix piece being part, but we're still continuing to test there. So definitely trending in the right direction.
That's good. So, fingers crossed. Do isolation periods done in other provinces count in New Brunswick? Example, if I isolate in Nova Scotia or PEI for 2 weeks and drive directly to New Brunswick?
No, unfortunately, we can't guarantee that you've maintained the safety that you need between those different destinations. So we prefer, in accordance with our mandatory order, that you do your self-isolation here.
Will there be any exemptions given to people traveling to the province for the holidays?
That's a very good question. As of right now, no, with one exception.
What's the exception?
So Santa Claus has been
Uh-huh.
exempted. So the COVID-19 operational plan that he has put forward has been reviewed. He is permitted to enter New Brunswick this holiday season. He has even pre-registered, which everyone must do. So please pre-register if you're planning to travel to New Brunswick. Make sure that you have your travel pre-approved by registering at www.gnb.ca/travel registration.
Peux-tu répéter ça en français?
Oui, alors une
S'il vous
exemption.
So there is an exceptional exemption is for Santa Claus. So for all people who thought that perhaps there might be problems with Santa Claus, no problem. There is an exemption for Santa Claus, and we are quite sure that he has a good plan. He even registered at our website to have his travel plan approved before he comes here to New Brunswick. Oui, bonne nouvelle.
For the upcoming holidays.
Well, I am very concerned about the present in terms of insulating New Brunswick and New Brunswickers as much as possible throughout the holiday season from the spread of COVID-19. And I know my counterparts in the other Atlantic provinces are feeling the same sentiment around this being a high-risk time with so much travel, with so many gatherings, etc. So we're really concerned and focusing on insulating ourselves at the moment so that we don't see a spike in the new year. I mean, nobody wants to go through the holiday season and find out that, you know, come January we see a large number of cases and outbreaks in the province.
How often do you talk to your counterparts across Atlantic Canada? You have probably one of the busiest calendars in government, and I'm just wondering, how often do you talk to the other CMOHs?
Well, we're just a phone call away. I think we're all on speed dial with our
Yep.
text messages and phone calls regularly once a week. But we meet 3 times a week or more with our counterparts across the country, and they're on those calls as well.
Speaking of the holidays, qu'est-ce que tu as planifié pour les fêtes?
What have you planned for the holidays?
Pour moi, j'ai une famille très...
Well, I have a very small family, so both children are teens, and they want to spend time with their grandparents in Bathurst. So we don't know what's going to happen because we have to see what's happening in all the zones, and I would have to have a holiday time to take. But if ever there are outbreaks, I'm going to be working Otherwise, certainly I will go to Bathurst, or my parents may come to Fredericton, and so that my children and my parents, and also my spouse will probably want to go see his parents as well.
Holidays, Doc.
Well, monitoring. Well, I don't think we're going to be going to people's homes to monitor what's happening over the holidays, but certainly our advice in general throughout the pandemic has been to keep our number of close contacts low. And because, again, there's such a high risk around the holiday season in terms of people traveling from outside New Brunswick and also gatherings, if you can keep your number of close contacts consistent, so if you have a list, I went through the exercise myself about a month ago. I wrote down all the people that I had interacted with over the course of 2 weeks in close proximity without a mask. And after I went through that exercise, I thought, I don't think I want this large number of people on my close contact list for two reasons. One, because that means that if I get infected, these are all the people that are going to have to stay home for 2 weeks, and I think they all have busy lives, and I wouldn't really want that to happen. But also it means that the larger number of close contacts you have, you're increasing your risk of becoming infected at some point in time. So if you were to take the time to go through that exercise, write down who you're interacting with over the course of a 2-week period, you will be surprised. And if you want to whittle that down to a smaller number, then at least you've got it on paper, you can see it, it's tangible, and then you can make some decisions and choices about who you actually want on that list and why not.
You've been saying keep it low and consistent. Mm-hmm. Are you worried about the upcoming holiday season? Est-ce que tu es préoccupé avec la période?
Are you worried about the upcoming holiday season? Is this why you were mentioning why the number of contacts should be as low as possible? It's very important to keep the close contacts as low as possible because during the holidays, people are going to be traveling. And we know that they will have to self-isolate for 14 days, and it's hard to do it in a safe way. So for self-isolating in a house with other people, you really have to look at our information on our website because they're very specific, and they give very good specific information as to how to protect the people inside your house or your home. So don't share a bathroom, and there's even information that we just received from Public Health Canada, which says that when you self-isolate, it's important to wear a mask, and it's important to stay elsewhere in the home and to receive your meals separately from the others. So lots of information to protect yourselves and others, because we don't want people, because for people who are supposed to be self-isolating, if these measures aren't followed, it could be very easy for the spread to happen. And we want you to protect yourselves. And also, I'm worried about the holidays when it comes to people who go to gatherings, large gatherings especially. We want the gatherings to be very small, and we want the people to see the very same people. So if you have the list of people who are close contacts with you and their phone numbers and everything, and once you've decided who you want to spend time with, maybe that list is too long. So, and it's possible you might transmit COVID-19. It could happen. But if you have COVID-19, they are the people who would have to stay home for 14 days. And I wouldn't want to stay home all alone for 14 days. So that's another reason why you have to be absolutely sure that the number of people you spend time with without a mask and at least 6 feet away, it's very important to keep that number of people very low. Also, think about mental health. We know that even when there's no pandemic, people still have mental health problems, especially at Christmas and afterward. And so people who have mental health problems, you have to know that there is information on our website to help you, but also call 211. Call 211. That's a way to get information, whether it's for mental health or for other information as well. I'm also worried about the safety of people. For some people, it may not be safe to stay home because there might be family violence, for example. So in that type of situation, we want the people to have a way to get the support they need.
Can we all meet in smaller groups, or?
Well, again, it's about risk, and it's about keeping people safe. And over the holidays, it is normal that people tend to travel more and they tend to gather more. But for this Christmas during a pandemic, for this holiday season, for all the different celebrations, it would be very important to maintain the same consistent people of interacting with over the course of time. So if you have, over the course of a 14-day period, it would be very important to keep that list of people that you're interacting with over that 14-day period quite low. So if you are attending any gatherings, it would be better if it's the same people consistently that you're gathering with for that entire time.
Okay. S'il y a un vaccin,
If there's a vaccine, will travelers and workers who come into the province, will they have to self-isolate for 14 days? Well, we know that vaccines have started. Vaccines have become available. We'll be giving them in New Brunswick soon, but we're not going to change public health warnings after having. We know that at this time it's important that we provide information, detailed information to New Brunswickers as to what the vaccine is and what its benefits are. So they will have a way of making informed decisions. But right now, people who receive the vaccine, whether here or elsewhere in the world, they will have to continue to follow public health directives. When will we be able to travel again without having to self-isolate when we come back? For now, we are trying to prevent the spread of the virus in New Brunswick and protect New Brunswickers from COVID-19. We are trying to keep an eye on community transmission in our neighboring jurisdictions, and we want to have an immunization plan, an effective one, and we're trying to work to have our people vaccinated, but we know that it can take almost 12 years in order to reach all the people with the vaccine. So I don't quite know at what date we'll be able to travel without having to self-isolate when we come back, because we just don't know yet. Okay.
work.
Oh my goodness, yes. We have just seen two examples where schools who were in the orange phase in their zones, when it came to having an exposure at the school, the number of close contacts, the number of people who needed to self-isolate as a result of those close contacts, again, very dramatically low numbers. So in that kind of a setting, we've seen, again, a couple of times schools who were in the orange phase during an exposure, whether it was a staff or a student, the contact tracing in terms of who was identified as close contacts, the number of close contacts was much, much less because of everybody wearing masks. So this has two benefits. One, it means that fewer people are exposed and at risk of developing of becoming COVID-19 positive and then transmitting it to others. But it also means that the issue of having to stay home for 2 weeks when you're identified as being a close contact of a case is less. So there were fewer people identified as close contacts because so many people were wearing their masks in the orange phase. So we have several situations that we can refer to now where that has happened. It's very reassuring in the sense that it makes sure that only the people who are at risk are affected and impacted by this. And the masks have shown us in these situations that it decreases the number of people impacted, whether by being at risk of developing COVID-19 and getting sick themselves, or having to self-isolate, having been exposed to somebody with COVID-19.
Well, it's not just about masks. It's excuse the pun, a layered approach, right?
Of course. So masks are just one of many, and I'm sure you've seen on social media, there are the Swiss cheese cartoons out there where they have many layers with holes in them because not one is effective on its own. So masks alone are not effective. The physical distancing, the disinfecting, the hand washing, all very effective, as well as our border measures, trying to keep COVID out, because we know we are seeing many increased number of cases in many jurisdictions across the country. Very serious increase in numbers of cases all around the world right now, which is resulting in lockdowns, in going into the red phase in many different areas. So we are very fortunate here in New Brunswick that we're not seeing that. And I think that all of the things that we are learning each and every time there's an outbreak is so important for us to be able to use that information moving forward before the next outbreak occurs, either to prevent it or minimize the impacts on schools, on businesses, and on communities, and obviously on people's mental health as well, and their ability to earn an income, which are all parts of the social determinants of health.
Do you need a sip? Speaking of masks, can you wear your masks while doing physical activity?
Well, technically, yes. Although high-intensity activity is more of a challenge in terms of wearing the mask. So in the yellow and the orange alert levels, the guidance to wear face masks whenever physical distancing cannot be maintained is there with respect to outdoors. And face masks indoors in the orange phase is, again, necessary in the orange phase. But again, the tolerance for people who are doing intense activity is probably challenging. So for high-intensity sports and recreation activities, the guidance is to wear a non-medical mask before and after the activity. Before the ages of 2 and 5, children may be able to wear a mask if supervised, and this will depend on their ability to tolerate it as well as put it on and take it off. And there's a huge variation there. So that definitely has to be something that is supervised. And in the orange phase, gym, fitness facilities, and yoga studios may operate under a COVID-19 operational plan with additional public health measures, including 2 meters of physical distancing with masks. In low-intensity fitness classes such as yoga, tai chi, and stretching, 3 meters of physical distancing for high-intensity activities such as spin, aerobics, and boot camp. So in schools, the guidance for mask wearing is in the return to school plan.
What is your definition of a close contact?
So the close contact definition would be in the document around case management for public health, and that would be anybody who is within 6 feet of you without a mask for more than 15 minutes. Now, there is an additional part of that definition whereby if you have multiple interactions with the same person, that adds up to 15 minutes over the course of the day, that can also be counted as somebody who's a close contact.
Question about COVID testing. If I get a COVID test taken in another province, does it count here?
A COVID test. Well, a COVID test is a snapshot in time. So from the time that you had the test and then you traveled and arrived here, it doesn't mean that you're not going to be COVID positive. We have seen in some of the outbreaks in long-term care facilities whereby we did rapid testing, I think it was in Zone 5 at one point, where somebody in the facility tested negative in the morning, and by 5 o'clock that evening was symptomatic and positive. So within several hours, you can go from negative to positive, again, based on how how COVID incubates, and then when you become symptomatic, and then you can be pre-symptomatic, you can be asymptomatic, and test negative or positive. But once you hit a threshold, you will test positive. And again, it can change in a day, in less than a day. It can change in a few hours. So the COVID-19 test is a snapshot in time.
Perfect. I already asked you, when is St. John going to go back to yellow? And are you not worried about the cases that might pop up from the holiday season?
Well,
When they're back in yellow, if and when?
so I'll always be concerned about outbreaks and cases.
Okay.
We know that even when we're in the yellow phase, that we can have travel-related cases, close contacts of travelers who may have thought they were self-isolating safely and perhaps weren't. Or there can be community transmission that arrives here at any time in any corner of the province. You know, a few weeks ago and continuing to recently, Nova Scotia has had some restrictions in place because of community transmission there. We know there's community transmission in many, many provinces of the country right now. And community transmission is very, very difficult to control because we don't know the source where people are picking up the COVID-19. So the contact tracing is difficult in terms of where could it have come from. And then how many other people are out there that are unknown and that are going to be asymptomatic, pre-symptomatic, and will be at risk of infecting many more people and exposing many more people without us knowing. So we did have a couple of cases pop up recently in Zone 2 whereby they were linked. We could figure out how they were linked to the outbreak, but they weren't on our initial close contact list. So it is possible to miss a few people here and there, but what we really know from the last the situation in Zone 2 and other situations similar to that is that in venues where you are gathering, having the close contact information, the list of attendees with accurate information. I think some people maybe who were going to some of these events might not have been taking it seriously and might not have given accurate information. That slows down contact tracing. We can miss people that way. But if the facility themselves hasn't really been reliable at doing that, that's a problem as well. But based on the enforcement and based on the information and education that we've been able to provide to people, we know that that's improved. But certainly over the holiday season, I will be very, very, very worried about situations where that's not happening regularly. So for us to have the safest Christmas possible, any venue, any event, any gathering of any kind, the close contacts have to be kept track of and noted and information, accurate information be identified.
Perfect. Marie-May, elle nous écrit...
Marie-May is asking, is it safe to go to shop in Moncton and surrounding areas? Well, in the yellow zone, really, the directives we have to protect people are the same no matter where you are, whether you're in Moncton or in Campbellton, Edmundston, St. Stephen, Sussex, anywhere. If you're in the zone, yellow zone, the rules are the same. Now, are you going to see a lot of people in the mall when you go shop? If you wear your mask and you wash your hands and stay 6 feet away from everyone, that's excellent. It's important to do that all the time during the yellow alert level in order to protect yourself.
It's about the vaccine. So when will the vaccine be available?
So the rollout is taking place across Canada, and my understanding through conversations with our partners at Public Health Agency of Canada and Health Canada, as well as our partners here in the province and planning it, the first vaccine should be available for the priority groups, which are identified at the national level. My understanding is it's going to be sometime in the next week.
Great. And you touched on who will get it first.
So priority groups are based on risks in terms of not just people who are at risk and populations who are at risk, but also the people who need to participate in the care of those people. Yes. So we are going to focus on the recommendations from NACI, which is the National Advisory Committee on Immunization. And but they are one of several groups that have provided input on that prioritization. And they are based not only on science, but risk assessments and scientific and ethical considerations and vaccine availability and allocation. So because we know there are 7 different vaccines coming, and the first vaccines that are going to be rolled out have different requirements for transportation, storage, delivery, et cetera. It's very complex to roll this out with dribs and drabs of doses coming at intervals that we know in a general sense that it's going to take probably a total of about 12 months to get everybody vaccinated. But those first few rolled out plans, the rollout plans will involve people who work in hospital settings, like healthcare workers who look after COVID patients, and then also people who work in long-term care facilities. So those two groups are very high on the priority list. There are others, but in terms of the top two, I would say those are the ones that we're looking at the most closely at this point.
Once you receive the vaccine, do you still have to follow public health safety guidelines?
At this point in time, yes, and I have raised this on our national calls with the Special Advisory Committee and Public Health Agency of Canada and Health Canada. And as of right now, we won't be making any recommendations to change anything around if you hop off a plane from another country and you've been vaccinated, you'll still have to self-isolate for 14 days as of right now. If you are a New Brunswick who goes away and comes back, but you've got the vaccine, at this point in time, until we get more data and until we have something more substantive to make that decision, it's going to be status quo for now.
So why will masks still be mandatory if you've had the vaccine?
Well, because we don't know if people who have the vaccine are going to be continuing to shed if they happen to have been exposed. So we are just, again, erring on the side of caution. We wouldn't really want to make things worse after trying to make things better. So I think based on the next 3 months worth of information and data, because we are going to be keeping track through surveillance of what's happening here in New Brunswick, but also what's happening globally, again, as we roll out the 7 different types of vaccines. So we'll be collecting a lot of information to inform our decisions moving forward. And as has been the case throughout the entire pandemic, it is an evolving situation. We have learned so much. We will continue to learn, and we'll continue to take that information and inform future decisions with that information.
I'm going to keep staying on the theme of vaccine. They just said that Greg McCollum, the director of the New Brunswick Emergency Measures Organization, will lead the provincial plan with the Department of Health and a working group to ensure safe, efficient deployment of vaccine. What do you think of that?
Well, at the national level, we know that the military has been involved. The great thing about Greg McCollum is he has a background in the military.
You guys have a history. I don't know if you want to say it.
Yes. Yes. So, yes, I was in the military. Greg was in the military. And I think when I got promoted from second lieutenant to lieutenant, he was the one who gave me my epaulets. But on that note, Greg is fantastic in the sense that he's been working for emergency measures operations for years. He is very knowledgeable in terms of crisis settings and emergency management. And from a logistics perspective, this rollout is going to be the most complex ever in history of a vaccine rollout. Again, as I mentioned before, the 7 different vaccines have different profiles in terms of the transportation, the storage, the distribution, and those kinds of things. So having somebody very, very involved in the logistics in this way is excellent. And at the national level, they have they are involving the military at the higher levels. So this makes perfect sense in terms of Greg liaising with our military if they're involved in any way. And but if they're not, then again, the logistics of our transportation, storage, et cetera, he's on top of that. I spoke to him this morning on my way into the building, and everything is on track.
Good to hear.
Yeah.
Will things go back to normal when I get the vaccine?
I don't think so, unfortunately. However, it is bringing us one step closer to going back to normal. And as I said, it's probably going to be a good 12 months before all of the vaccines are rolled out. And again, things may change between now and then. This has been an evolving process. We will keep our eye on what's happening globally. We'll monitor the situation. And whatever new things we learn, that's what we'll use to make our decisions moving forward. So as of right now, I know there are some other countries that think it'll be shorter than 12 months. So I think we just have to wait and see at this point. But certainly it's hope. It's a move in the right direction for sure. And I think after living this for the last, are we at 10 months now, 9 months? It feels like longer.
Yep.
But because we've been living this so long, having something to look forward to is really important. So I think it's really helpful that for us to all look forward to when we are all vaccinated. But in the meantime, we will still have to be cautious and follow public health guidance.
Parents are asking, should they be wearing masks at school bus stops?
Well, again, if you're in the yellow phase, technically masks outdoors is not required, but certainly if you want to take that extra measure in terms of safety, it's not a bad idea. But certainly in the orange phase, it would be necessary.
Good to know. We're already talking winter.
Winter, huh?
With the onset of winter, while we are wearing gloves and mittens, is there a danger of transmission from touching handles or like such? We don't wash our gloves as often as we wash our hands. I'd like to know if there's a danger of contamination with groceries. Should we always should we wash our groceries and is washing fruits and vegetables in cold water enough?
Well, should, could.
Yep.
I think if you're looking at the bare minimum of what we need to be safe this winter, obviously we're going to be washing our masks regularly because that's a given, that's necessary. And that's a new behavior that people have adopted since the beginning of the pandemic. People didn't used to wear masks, now they're wearing masks, and not only do they have to wear them, they have to wash them and have multiple masks. And now we have, the increased risk of having surfaces that can be contaminated. So people are washing and cleaning and disinfecting things more so than before. So I don't think it's too challenging to take that extra step and wash your mittens, et cetera, a little bit more frequently as well while you're washing your masks. So they all add up. So you're decreasing the risk with each and every one of the small gestures and small behaviors that you're adopting in terms of becoming routine. So we don't know exactly how long the COVID-19 virus lives on different surfaces.
Yep.
Evidence suggests that it can live on objects and surfaces for a few hours to a few days, depending on the type of surface. So that's why we are encouraging people to clean with soap and water and detergent so that you can kill whatever germs are on surfaces. Cleaners do not necessarily kill germs, but cleaning can remove the germs so that they are lower in number. So that can play a role in reducing the risk of spreading infection. And medical masks, mittens, face scarves, they should all be washed regularly because they can get your droplets in them, and so and other people's droplets, etc. So you need to be aware of that. So it's a good question. When you remove it, you do have to be careful. I mean, when people are in the hospital setting and they're removing and putting on their protective equipment, they do take care. So you can't just leave it anywhere. Make sure that you think about it as something that might have germs on it and that's contaminated. So. And again, there's some information on this from Health Canada in terms of what to do around medical masks and face coverings and how to wash them safely, et cetera. And then according to the World Health Organization, the main way that COVID-19 spreads is droplets among people who are in close contact with each other. So, but we also know that it has happened that people have contaminated other people by touching surfaces that were contaminated. So.
I'm going to stop you there because you mentioned something on Sunday at the press conference about a New Brunswick person who got COVID in their house.
Oh, yes, that was a CBC story. And I contacted that individual to talk about that because they weren't even in the same part of the house when that person was visiting. I think the person was visiting in their kitchen and they were elsewhere in the house. But I don't know the order in which people were infected in the household, but certainly that person was very forthcoming, and I think her name was Kelsey, correct?
Yes.
Kelsey, yes, Kelsey. She was very forthcoming and very positive about her experience, but the fact that she was highlighting the risk that people can get COVID-19 infection from people visiting their homes, and it wasn't a very long visit.
So that's why it's imperative to clean your surfaces.
Exactly. Exactly. Yeah.
Sylvie nous écrit, est-ce que
Sylvie is asking, can you, in a yellow Zoom, can you confirm that we don't have to have masks in parking lots? Okay. In the yellow phase, you don't have to wear a mask when you're outside in public areas.
Greg, who's asking, you touched on it earlier, but where can individuals go who are feeling depressed and anxious go for emotional support?
Well, again, I am very concerned
Yep.
about people's mental health. I think throughout the pandemic that has been a challenge for people who had problems with mental health before the pandemic. They're having more problems now, and the holiday season exacerbates that even more. So there is 211 they can call for some support and resources there, whether it's finances, whether it's mental health, et cetera. But also on our website, I think there's a CHIMO number, there's other numbers and email addresses on our website. So definitely get the support there. But family and friends, I mean, if you are aware that you have a family or friend or colleague who is at risk, again, keep reaching out, asking them for help. It is difficult for people with challenges to ask for help. I think that's one of the hardest things for anyone is to ask for help. It is easier if people are offering it. So if you have your spidey senses around who to help and when, it is really important to keep reaching out. And I think there's probably going to be a huge need for extra donations to food banks and shelters, et cetera. So those are also places to think of putting your efforts.
For children, there's also Kids Help Phone.
Yes.
That's something that, any concerns for the mental health of those that can't see family members over the holidays because of residing in the orange zone?
Well, again, and this can happen to anybody in the province at any time because, as you know, it doesn't take very long for outbreaks to occur and to spread. So I think, number one, let's all do our part to stay in yellow all around the province, number one, for all the reasons that we've talked about already, including mental health. But I think there are some resources as well on our website around how to safely have a holiday season, knowing that, you can't be with loved ones, whether they're in an orange zone or whether they're outside of the province and they can't travel. So I think that is one of the issues that has really contributed to negative impact on people's mental health. There are creative ways to connect virtually. And then, again, if there are people in your community that you know are lonely or can't be with family and friends, reach out to them. You might have the luxury of, like I have the luxury of my parents being in the same province. If we happen to be in yellow, I will be able to see them. But there are many, many people who don't have that luxury. And if you are aware of that situation and you can reach out to them, that would be fantastic. So that people don't feel alone, they don't feel isolated, and they don't feel abandoned and the victim and at the mercy of the pandemic.
Remember the days where we used to pick up the phone? Now you can Zoom.
Oh, yes. Actually,
Remember those?
my son is a teenager, and what was I watching one day? And they were talking on the phone, and we talked about the fact that, when I was growing up, you had to pay long-distance charges, and my family only contacted their family that lived a long way away on Sundays and at a certain time, and when the rates were a certain, and you had to cut off.
I remember those. It was Friday night.
Yes, yeah. And then my son has friends who live in New York and some other places around the world, and he was chatting away. I think they were on, I don't know what chat method they were using, but there was no cutoff or, oh my gosh, this is costing me a fortune.
Yeah, there's more ways to reach out, obviously.
Yes.
Andrew writes, when the vaccine is rolled out, what criteria are you going to be using to determine the order? Will it be based on health, just simple age, or the complication from COVID risk?
So all of those things are taken into account when the different organizations that had input into the prioritization recommendations. So the National Advisory Committee on Immunizations prior to the pandemic was really the Bible of the recommendations around any vaccinations, whether it was the flu vaccine, 3 versus 4 parts to it, the high dose versus other things, the rotavirus vaccine, the HPV vaccine, the shingles vaccine, any recommendations around vaccines, whatever the case may be, all of our information and advice came from that committee made up of people all across the country who are experts in those fields. And we have great interface with with that organization, with our own experts in public health here in New Brunswick. So prior to the pandemic, that is where we got all our information and advice around vaccines. Since the pandemic, that is one of the main drivers of information and also input for decision-making around vaccines and prioritization. But there were also some other organizations involved in the discussion as well, including Indigenous organizations at the federal level, also the Special Advisory Committee, which is made up of all the Chief Medical Officers of Health in all the provinces and territories, as well as the Chief Medical Officer of Health for the country, Dr. Theresa Tam, as well as membership representatives from Health Canada. So there are about 5 organizations that had input into that prioritization, and it was around not just who the vulnerable populations are, because obviously we know that long-term care facilities have had many, many outbreaks across the country, and that is a huge vulnerable population, but also healthcare workers who look after that population, as well as healthcare workers who look after COVID patients in hospital settings. So as of right now, those are the top prioritized groups, and then as we roll out all 7 of the vaccines over the course of the next 12 months, we'll work through the other prioritized groups in an order that matches their risk and all of the different complexities of the distribution and et cetera of the vaccines.
Do you need a little?
Yeah.
Emily writes, will we reassess the Atlantic bubble before Christmas?
I have heard that question. It's not a new question. Again, I spoke with my counterparts yesterday on the phone from the Atlantic provinces. I know Nova Scotia is imposing their restrictions for, I think, until the 21st of December at least. There isn't a huge appetite for anybody to change anything right now. I know PEI has just put on a circuit breaker for 2 weeks. So I think...
What's a circuit breaker?
So a circuit breaker is really that heavy lockdown of restrictions where people, like, things are closed and people are staying home and decreasing their interactions with others. Because as you know, what we went through in the first wave is what you can do to stamp out the virus pretty quickly is have everybody stay at home. But again, we know that doesn't work for a long period of time in terms of the negative effects. It works, but it has a really negative effect on people's income, their mental health, children's ability to get an education, et cetera. So we try to only use those kinds of measures when they're absolutely required, and PEI being such a small province with a small amount of resources in terms of dealing with outbreaks, it is in their best interest to sort of nip it in the bud before it gets worse, especially if there's community transmission.
Before I get to Dave's question, you know, the bubble, we are surrounded by other jurisdictions where they're having a tough go, like our next door neighbors to the southwest. I know Maine is a concern, Quebec.
Yeah. Across this country, it's heartbreaking. You know, when you read the stories, originally in the first wave, I remember seeing the photos on social media of what was happening in Italy, and then what was happening in New York, and when we did our modeling and our predictions around, you know, what's the worst case scenario, my goodness, I hope that doesn't happen here, and what can we do to prevent it from happening here, and all this work was done, and it was great. And now to see the second wave happening in a way that we couldn't have even imagined would touch Canada. So now we see provinces like Manitoba, Alberta, Ontario, Quebec, Saskatchewan, BC, all struggling with record numbers of cases and overwhelmed hospital systems. So we don't want to see that here, and we have been so fortunate based on everybody's cooperation. I mean, this has been a collaborative effort.
Yep.
This has been a collaborative effort with citizens, with public health, with all parts of government, with the regional health authorities, with the COVID-19 cabinet. I don't think there's any place on the planet that has worked this particular way as successfully as we have up till now. But as the risks continue to increase all around us, the risks of travel-related cases is continuing to go up. And so we're seeing those risks go up.
Yep.
We're still in the second wave. The second wave hasn't peaked yet. Places that were very negatively impacted in Italy are now going through that second wave. Again, tragic, just tragic to see these things happening. So we have a lot to be thankful for right now, and we do have the winter months to get through. So it is important for us to keep on keeping on and stay the course. Again, I think everybody in this province has been sacrificing a lot, has been doing their utmost to get us through this. I cannot say how proud I am of the people of New Brunswick for being front and center of a crisis, a global crisis. And we are where we are today, again, thanks to all these people working together. I am so proud. So we do have more work ahead of us. We have hope with the vaccines coming. But yeah, I want to get through a safe holiday season and not have a spike in January.
Are the CMOHs sort of jealous of us? I see what's happening across the western provinces, and I feel bad, but...
Well, I don't think they're jealous per se.
Envious?
I think there's a healthy respect for what everybody's going through.
Good.
You know, every person across the country is living a different experience, and even people within this province are living a different experience. So just because the overall population is doing well, if you look at it on paper, that doesn't mean that this isn't impacting individuals in New Brunswick in a very negative way. And sometimes the people who are looking at the positive outcome of, wow, we've done so well, it doesn't take away the factor, or it doesn't take away the fact that some people are living a very negative experience right now because of the pandemic, and their lives are being impacted in ways that may not be the same as what's happening in Alberta or Ontario or Manitoba, but it's still real and it's still impacting them, and it still needs to be addressed, and their voices need to be heard, and they need to have the support that they can access.
I promised Dave I'd get to his question, so...
Oh.
Ontario has announced that a card will be given to all that will be vaccinated as proof as they did. Is something like that being planned here? Have you heard anything?
I just read that myself earlier today, and I know we have... the idea was floated around because of that story, but I don't think anybody's landed on anything at this point. I think there's a lot more surveillance that has to be done. Just capturing the data in terms of who's vaccinated, who's got their first dose, their second dose. I mean, there's a lot of things that we need to make sure happen. That the jury's still out on that one. We'll have to have some more conversations on that.
Okay, we'll
no
get
promises.
Back to, we'll get back to Dave on that one.
Yeah.
Jody writes us, what if you've already had COVID? Do we still need to take the vaccine? Also, will there be a test for those which will confirm if you've had it so you don't need to take the vaccine?
That's a great question. Because we don't know how long the immunity lasts once you've been infected, I'm not sure if people will have a serology test, which will see if you have remaining antibodies rather. We don't know yet if that's going to happen or if people are just going to automatically get the vaccine. So more to follow on that. We'll keep you posted.
Okay. Well, that's the time. Jody had the last question, and I want to thank everybody. Continue to write your comments. Thank you for joining us this afternoon. This session has actually been recorded. It will be saved on our Facebook page, and it will be shortly uploaded to our YouTube channel for the Government of New Brunswick. Merci beaucoup.
So thank you, everybody. This was recorded, and it will be saved on our Facebook page as well as posted on our YouTube pages. So have a great day.